We are the Nigerian Development Group, a community outreach program based on health, education, and awareness, where our vision statement is to ensure a nation where people can experience the basic health needs, ultimately enabling them to live long, healthy lives. We believe we deserve the $1 billion grant from the Luna Foundation because when there are people in need, we know that we can go in and get the job done in a timely and successful manner. Nigeria, despite being described as the economic giant of Africa, having the largest population, and existing as an independent state since October 1st, 1960, is extremely underdeveloped. Health disparities in Nigeria are extremely high. Most Nigerian citizens' health needs are unmet. In 2013, only 9.8% of women that were currently married used any modern contraceptive method. Only 10.1% of the female population and 9.9% of the male population received an HIV test and result within 12 months. Nigeria's health expenditure is only 6.1% of their total GDP, ranking them 109th amongst official countries. These health issues will inhibit social modernization. HIV/AIDS is a major issue that needs to be addressed within the country. We are the ideal organization for the job because we have done extensive research and understand what issues need to be addressed and how. We understand that some goals, such as eliminating HIV/AIDS in Nigeria altogether or quelling ethnic and religious conflict completely, are impractical. Instead, we have chosen a problem that we are capable of solving and could expedite Nigeria's modernization. If we manage to aid Nigeria's modernization and growth through improvements in health, it may spur growth in the surrounding countries and possibly the rest of Africa. This kind of catalyzer could be the key to Africa's modernization. We understand the importance of community engagement and we are eager to work with the people of Nigeria to diminish health disparities. In Nigeria, HIV/AIDS is one of the most destructive forces holding social and health progress back. Combating HIV/AIDS is one of the United Nations Millennial Development Goals. Yet little progress has been made on the major battlefield. Nigeria ranks number 1 in deaths due to HIV/AIDS in comparison to the rest of the world. In 2012, an estimated 239,700 Nigerians died due to HIV/AIDS, and another 3,426,600 Nigerians were living with HIV/AIDS. Additionally, there were an estimated 2 million children orphaned due to the disease. Addressing the issue will improve the Nigerian people's overall quality of life and could help them in Nigeria's modernization.
The most ideal solution would be building a health clinic in each state of the southern region of Nigeria. We chose to test the health clinics in the southern region of Nigeria because they have historically been more receptive to the Western world. The south is also more stable than the north. The northern region is more difficult to work with due to the strong Muslim influence and the presence of the terrorist group Boko Haram. For these reasons, the southern region is more ideal for us to implement our solutions. First, we plan to build the health clinics. Each health clinic will be equipped with medical supplies that provide HIV/AIDS testing, treatment, and care. It will also offer various forms of protective contraception to give out to any patient in our clinic. Our clinics will also provide formula for newborn babies so that mothers will be able to avoid passing on HIV or AIDS to their infants. Not only will our clinics provide medical health care, but they will also be sites of employment and education for locals. We will train and employ locals to better relate to other Nigerians in the area. We will also offer training and educational programs for the village midwives and leaders. They will be trained on the importance of using condoms and protection during sex, and being careful to feed newborns only with formula if there is an HIV-positive mother. We will also provide an incentive program so that we get a greater turnout of village midwives and leaders to come for trainings. Our incentives will consist of free anonymous HIV tests, antibiotics, condoms, and clean birthing supplies. For our solution, we are requesting a budget of $1 billion. Every dollar is essential to carry out and implement all aspects of our solution. Our budget will be split up into 5 sectors of physical building, staff, medical supplies, educational supplies, and an incentive program. We will use 30% of our budget to pay for medical supplies such as needles, antibiotics, and HIV testing kits. 25% of our budget will go to funding staff of both Western professionals and Nigerian locals. Another 25% will go to the physical construction and land development of each clinic, and 10% will each go to the educational supplies and our incentive program. We anticipate a degree of resistance during the implementation of our development program. As the southern region of Nigeria is predominantly Christian, religious values prohibit the use of certain forms of birth control. To circumvent this issue, we plan on specifically approaching community leaders and convincing them that HIV/AIDS is a critical health issue rather than a religious one. We also plan on gaining the support and trust of the community by providing workshops for younger male and female populations, encouraging abstinence as a form of birth control as well. As an organization, we feel that if we are provided with a $1 billion grant, we can successfully implement our solution. Our health clinics will help prevent the spread of HIV/AIDS while treating individuals who have already contracted HIV. The training and educational aspects of our clinics will also help to spread awareness for the health issues that Nigerians are facing with HIV and AIDS. Through our solution, the Nigerian Development Group will be able to provide Southern Nigerians with a healthier, safer place to live.